Hi, good morning. We're going to demonstrate a non-surgical rhinoplasty. Again, you've seen this procedure by me on video before. You've seen me use Restylane. My preferred choice is Restylane 95% of the time. On some patients with extremely thin skin, I start with Juvederm. I may switch them to Restylane later on, but most of the time it's Restylane. I don't like Bellafill, I don't like silicone, I don't like Radius. I don't like things with particles that are too inflammatory or it can cause permanent problems. Restylane is the best of both worlds. It's natural, it can be melted away, it goes away eventually, but it has some structural support and rigidity, and it's got a higher G prime, so it gives us shape. We're going to do non-surgical rhinoplasty right now. So, we're going to start. It's basically a microdroplet technique, starting with the radix. Tiny little poke. How bad is it?
I don't even feel it.
Not terrible?
Mm-mm.
Okay. Somebody once made a comment on our Instagram or YouTube, I'm not sure which one it was, that, oh, I thought it was only going to be just 3 pokes. Well, you can't fill the whole nose with 3 pokes. And I've seen that with even lip injections. Some doctors just trying to push it all into one spot and then massage and massage and massage it into place. The right thing to do is put the droplets, put the injections where it needs to go, not have to rely on moving it with your fingers. So we start off slowly. Some topical numbing has been applied to her skin. Like all of my injections, they're microdroplet. You can see me inject something 10, 15, 20 times and I barely used any amount of volume. What that does is it puts the particles in different levels. They don't clump up as easily. Much less likely for it to create problems. And also last longer because the particles are at different levels. Tiny little microspheres of collagen and fibroblasts form little capsules around them and last a little bit longer. I do it from different directions. I always check for symmetry. I've never seen a perfectly symmetric human, but you certainly don't want to make people less symmetric, and you can actually make them more symmetric by injecting it properly. So little by little, it starts to shape. Now, it takes about 5 minutes, 10 minutes to inject. You can enjoy it immediately. The beauty of this versus surgery is that it's usually more symmetric. You can put a drop here, a drop there to create beautiful symmetry. It is more customizable. You want to go higher, add more. You want to go lower, wait a few weeks. There are certain things you cannot do with this. Not everybody's a candidate. But for those who are, if all things are equal, I actually honestly prefer this to surgery. Sometimes after a rhinoplasty, this is a good option to make it even better. It's impossible to make things perfect with surgery, but with a couple drops of a filler after surgery, you can often make it perfect. As you start coming up and taking a look at the bridge, you can start seeing how nice she starts forming. You got definition right here. This is the normal amount of bleeding. It'll stop, and you can basically put some makeup and enjoy it tonight. And I've put about half of it, so we're going to keep going. I'll show from different angles and levels. Now, the 1 cc of filler, any filler, is not 1 cc of filler. What that means is, when you take a Motrin or ibuprofen or aspirin, the whole pill is not made up of medication. There's starches and carriers and other material within the pill. Same thing within all of these fillers. So a certain percentage of the syringe is actual hyaluronic acid, and the rest of it is material that will go down. that will appear as swelling for the first few days because there's some extra material in there that goes down. But it's ending up looking really good. She's gonna like this a lot. You doing okay under there?
Mm-hmm.
All right. Patient drove from a long way to come here to get poked, but she can go out tonight, Friday night, enjoy this with no downtime. Now, there are people that do this and kind of overfill or almost treat everybody that walks in as if they're all candidates for it, and they're not. You have to choose the right candidate. You want to make the nose more attractive. The goal is not just to fill the nose and take the patient's money. That's not the goal. The goal is they need to have a nice nose. And now she's formed a really nice bridge. You can see the bridge. We still want to have a slight little curvature, be feminine, not get crazy. We're going to do a little bit to the tip. Tip is a little bit more sensitive, so hang in there with me, okay? Little poke. Stay right in the midline. Right smack dab in the midline. Don't force the filler in. Very gently. Pushing it in. You never want to force the filler in. That can cause occlusion problems. If you feel any resistance, you don't push on it. One more. That's right down the middle. Avoiding the columellar vessels. You don't want intravascular injections. What this does, it gives us more projection, brings the tip up, and gives us a nicer curvature. By doing this, it allows me more room to do more to the bridge. She looks fantastic. As we go, it becomes even more and more numb, more and more comfortable. I check for symmetry. I check, make sure everything looks perfect before the patient leaves the office. Patients tend to leave and tend to look and look and look in the mirror. One more to the tip, into the infratip lobule a little bit, right in the middle. Little poke, very gentle, and holding it to shape it. Now you cannot narrow nostrils non-surgically, but once this is elevated, this is improved, the nostrils will immediately appear more narrow. It's just an illusion that happens. The lower the bridge is, the wider the nostrils appear. Almost done. This is also great for people with some crooked noses, because if one area is indented on one side, by injecting that side, you can really improve the nose. There are patients who've had trauma or congenital asymmetries or just had a nose job they're not happy with, and they don't necessarily need to go through another surgery. This can definitely improve things. There's no bruises that I see whatsoever. This bleeding is totally normal. And we're done. Whole syringe, whole CC is done. Goes away, holding a little bit of pressure. My only limitations are no exercise, no gym, no yoga for about 48 hours. No glasses on the area. But that's it. I mean, they can enjoy it immediately. You can start, if you kind of start seeing the contour, looks really nice. And we'll take some pictures and show it. So that's pretty much it. That's another non-surgical rhinoplasty. We do these all day long. I love doing non-surgical rhinoplasties in the right patient. And I think it's a great, great procedure when done properly and in the right patient selection. Have a good one.